home here twice, once because of Franklin County. I guess I do have to ask because I heard you as soon as I walked in the door. How many other graduates of the old St. Anne's Academy might be here? Besides Kathy? Almost?
I went up until 1960 with Christopher.
Yes, I keep telling people all of the things you may have heard about my time in Swanton are lies.
All true.
I spent most of my time in Swanton either in school or posing for holy cards. My St. Lawrence on the griddle is still a collector's item, and you should see my St. Stephen card. It got me through high school. None of the other things you hear are true. The other reason I'm happy to be here is I'm back with home care. I love what I'm doing at Fletcher Allen, but Fletcher Allen is, as my middle school granddaughter would say, is ginormous. The scale is completely different. You know, there's 7,000 something employees, and I really miss the close interaction with the team who are actually doing the work. And no one is closer to doing the work of healthcare than home health and hospice. So I feel like I'm back home again with you as well. I hope you can see the screen. Maybe, can everybody see the screen? It's central to my whole presentation. Moving back, you're going to miss all. I worked for a good 20, 25 minutes on it. I want you to see the fruits of my labor. But my theme is the times they will keep a-changin', because I think that if there's some people here who are almost as old as I am, and if we think back over healthcare, that means that some of us actually remember before Medicare. And we've had turbulence every year since then, and it's a little bit like taking a long continental flight during August and thunderstorm season. I mean, the pilot never has turned off the seatbelt sign. We have been shaken across the entire country, and I think that we're going through a period right now of particular turbulence. But let's shift metaphors and talk about a road. Yes, it works. There are two roads on the screen. We can decide which one is the road behind us and which one is the road ahead of us. They both have some characteristics that they share. They're both twisty and turny. Neither of them have any warning signs. There's no speed limit, but this is the path that we have come through, and this is the path that lies ahead. From where I sit, the path on the left is the one we've come from. It's mountainous territory. It's not very pretty, but at least if you go off the road, you just get stuck in the sand. The one on the right-hand side is also twisting and turning, but if you go off that road, you either run into the cliff or you fall over it. And on a lot of days, that's what it feels like to me. We go to the next. This is a warning sign that actually appears in South Africa. Beware of falling elephants. And I use this because you never know, but if you've been in healthcare for more than 3 weeks, you know that something is always going to fall on us. The only thing we don't know is exactly what it is or when it's going to happen. But we are cautiously aware that elephants and other things are going to tumble down on top and change our plans at any moment. It might be a piece of state legislation. Some of us remember the glorious days when the Department of Justice was in Vermont, looking at Vermont home care. That felt kind of like an elephant falling out of the sky on us. But over time, you get a little resilient, and we don't despair, we don't worry. We've been through this before. I hope everybody can see this next slide. It's one of my favorites. If we could go on to the next one. We don't despair. We've been through this before. I was able to identify a photograph of someone that you used to work with you. This is a picture of Jim Manahan at deer camp. I'm sure you recognize him. And next time you see him, be sure that you tell him that I found the picture and I used it. But, we're not living in caves anymore. We have been a creative species, and we have made it through times of trouble. We've addressed changes in healthcare needs. We've addressed changes in the way healthcare is delivered. We've addressed changes in financing. We've addressed changes in the environment in which we work, the legal environment, the public policy environment, and in the clinical environment. In the 1960s, for example, in the 1960s we had no Medicare and Medicaid until halfway through. Computers in healthcare were an absolute novelty. And moving into the 1970s, we started taking pictures of people that weren't x-rays. We started talking about CT scanners for the very first time. Certificate of need came into our lives. And hospice developed. It's hard to believe the work that we do today. In the 1970s, it was before hospice. We cared for the dying, we just didn't know quite what to call it, and we certainly weren't paid for it in the way we are today. In the 1980s, they started to seriously start changing the way we're paid. It began with the DRG payments for the hospital community, and that transitioned into PPS payments for nursing homes, and then early in the 2000s or late in the 1990s, PPS came to home health and hospice. The 1980s also brought us AIDS. And for, I'm sure, Franklin County Home Health, as it was for Chittenden Home Health, there was a period of time when AIDS was a very big part of the work that we did in our communities and how things have changed since then. And now in the 2000s, we have the Affordable Care Act, also known as Obamacare, that is influencing what we do on almost a daily basis. Change, twisting roads, turbulence in the air. It's been going on for a long time. When I teach people about each of the presidential administrations who have focused on healthcare reform, and you can start actually with Teddy Roosevelt. And I'll give Janet an electric copy of what I'm showing you, but it goes through administration after administration since FDR, because FDR, of course, had the big battle during the Depression whether he was going to get Social Security for Americans or health care security for Americans. And Social Security won, and the only part of health care we received was something that's still very important to us. It was the Maternal and Child Health Amendments, also passed in the 1930s, that led to the MCH funding that we still have today. But that was the only thing that he could get for health care, was for children. Through others that we might not think about, Richard Nixon had a distinct platform that included fundamental health care reform. Didn't go very far, but it was on his. If we go on to the next, Ronald Reagan and his team had strong ideas about how to improve American health care. It wasn't until we really, though, in modern times, reached the Clinton administration that the political waters were really ready for a concerted effort to fundamentally reform the work that we do. And of course, it was ahead of its time. It was foundational, but it did not work. There were great lessons learned that in fact carried through with President Obama's more recent successes in terms of what was politically possible and what was politically impossible. But President Obama would never have been able to do what he did, or what he's done, without going through what the Clintons went through in the mid-1990s. When we talk about healthcare reform, most other states don't think about it the way the predominant view is in Vermont. The rest of the country are on the opposite side of a new political divide, where when they think about healthcare reform, for decades the perspective was, I hope it doesn't happen here. It'll all go away. And then with the passage of the Affordable Care Act in 2010, it was, oh my goodness, what's happened? Let's hope the Supreme Court can change it. That didn't work, so let's hope the 2012 elections can change it. That didn't work. And now they're in passing through this phase of, oh my goodness, is it really going to happen? Will they really tell us what to do? And how much would it cost to move to Ecuador? In Vermont, though, we have a different political perspective is the dominant perspective. Both of these perspectives are available in Vermont, but in Vermont, the predominant perspective hasn't been so much, God, let's hope it doesn't happen here. It's been this appetite for how soon will it happen? How can we teach the nation? How far can we go without the feds getting in the way? When 2010 arrived and the Affordable Care Act passed, it was, oh Zeus, thank you. At last we've got something, but it doesn't go far enough. And what can we do to go further than that? The times they will keep a-changing. Want to talk about, we can just jump right ahead, talk about some universal truths. No matter where you are in the country and what your perspectives are about healthcare reform, as I've just described them, there is a growing consensus across the entire political spectrum that the current system is unsustainable. It's very hard to find public speakers today who will speak from the position of everything is okay, it's not as bad as it sounds, I think we can just keep on going like we're doing. Very hard to find those speakers. There is a growing sense that change is inevitable, and that sense is inside some long-standing areas where people felt it would never happen. The insurance companies of America now are committed to fundamental change. Labor unions are committed to fundamental change, big business, and state and local governments. There is like capital R change and lowercase r change. Capital R change are things like the big political bills. But lowercase r are just as fundamental, like the clinical reforms that we're seeing right now with, for example, the primacy of primary care. How long has it been since everybody thought that the specialists were the folks who were really cool, and the primary care docs probably just barely made it through? Where now that is all flipped on its head, and primary care is king of the hill, or queen of the hill, if you will. But we're also seeing other smaller lowercase r changes. We're seeing a gradual disappearance of private solo practice, independent practice. In Vermont, every year, a higher and higher percentage of Vermont doctors are employed by hospitals. Here in Franklin County and across the state now, the vast majority of Vermont doctors are not in their own private practices. They are in employed relationships with their local hospital. We can move on to look at other things in clinical practice. Hospitals are, Vermont is not overbedded, as they say in the industry. We still have about the right number of beds for Vermonters, but around the country, there is a growing problem with too many hospital beds. Hospitals have grown too big and too quickly. And in Vermont, we're still just about right, but even in Vermont, we know fewer and fewer hospital admissions, shorter and shorter hospital admissions. We know that there is something called the over 85 avalanche coming for baby boomers who are aging, who will mean that every medical student graduating from college today, every nursing student graduating from college today, whether it's in their career plans or not, will spend a substantial amount of their professional life dealing with death and dying because of folks like me. We can move on to healthcare policy. There is increasing public sector involvement in private enterprise. It began during the Great Recession. One of the consequences of the bailouts of the American automobile industry was the legitimacy of the public sector, Congress, getting into private healthcare. It provided the political cover that was needed. We can look at the next page for healthcare policy. Healthcare policy has addressed a rediscovery of public health. Public health had its heyday at the turn of the previous century and kind of slowed down, and all of a sudden, one at a time healthcare, one patient at a time healthcare became the in thing. Now public health has been rediscovered. We're calling it population health, but it's essentially public health practice is again becoming in and cool and hip. And finally, in healthcare policy, everybody's talking about the triple aim. You cannot give a public speech about healthcare in America today without talking about the triple aim. It's become the single focus of the healthcare industry. And it is to improve the quality of patient life. It is to improve the wellness of populations. And it is to temper the increase in healthcare costs. The three aims that were established by a fellow by the name of Dr. Don Berwick when he was running Medicare and Medicaid until recently. Also, what's happening right now in both capital R and lowercase r is the accountable care explosion. Shortly after the passage of the Patient Protection and Affordable Care Act, the Obamacare Act, every major medical journal in the country featured front page stories on accountable care. Accountable care is a strategy for reform that is sometimes called a reform trifecta, because accountable care reforms the structural relationship among healthcare providers, between doctors and hospitals, between hospitals and hospitals, between providers and health insurance programs. The second part of the trifecta is accountable care reforms healthcare practice. Clinical practice is designed to change and improve through the accountable care system. And thirdly, the third part of the trifecta is accountable care is designed to change fundamentally and forever the way we are paid. In Vermont, we were like a western forest that was as dry as a bone, and somebody threw gasoline on it and started it burning when the state of Vermont received the State Innovation Models Grant. We received a $45 million SIM grant in Vermont, and it accelerated, it exploded the pace of accountable care change in our state, where right now there are accountable care organizations in Vermont, one very large, one very small, focused exclusively on Medicare. In about 100 days, Vermont will have statewide accountable care efforts for Blue Cross and MVP and for Vermont Medicaid, in addition to at least one and possibly two more Medicare ACOs in the state. A lot of this is fueled by the resources that have been made available through the SIM grant. I'm the Chief Operating Officer for OneCare Vermont. OneCare Vermont is the large Vermont ACO, accountable care organization, representing every hospital in the state, over half the primary care providers in the state of Vermont, the majority of specialists in the state of Vermont who care for the elderly, every single hospital in Vermont, plus Dartmouth, including the Brattleboro Retreat, all serving now the Medicare population. We have a direct responsibility for 50,000 Vermonters and their health care. We're 9 months old. It's happened very, very quickly. An accountable care organization is a voluntary association of healthcare providers who come together and sign contracts with each other and with a payment source, right now mostly Medicare, where they pledge to further the triple aim: better quality care, better health for entire populations, slower growth in healthcare costs. So things are, the accountable care system, which I'm happy to talk about in more depth because we're time limited this afternoon, but I'll stay around and we can talk about it some more if we want to. It also reflects, as I said, delivery system structure. Some things that are happening right in front of our nose very, very quickly. Fletcher Allen Partners, for example. Fletcher Allen used to be one hospital. It's now 4 hospitals, including 2 hospitals in the state of New York. Within a matter of years, Fletcher Allen Partners, the mother company for Fletcher Allen Healthcare, will probably be 6, 7, or 8 hospitals. in our region in both New York and in Vermont. Fundamental structural reform. And also what I would call strange bedfellows. Fletcher Allen and Dartmouth Hitchcock used to be a little bit like the Yankees and the Red Sox. They just didn't mix. And right now, Fletcher Allen and Dartmouth Hitchcock are getting deeper and deeper into each other's pockets as business partners. And everybody's looking around and saying, what's going on? These folks used to be eating each other's lunch. Now they're taking each other to lunch. Something is changing. Finances are changing. The day is coming when most of our patients will have health insurance. Something we've never experienced in this state. We've done very well without affordable care, the Affordable Care Act, and insuring Vermonters, but the day is coming when virtually everybody we see will have health insurance. It's going to change our business. We are going to be changed. We're going to be paid in fundamentally different ways. I'd like to compare it to a roofer. I had a roofer work on my house, and I had one roofer come and said, I'll do your roof for time and materials. As much time as it takes me, and as much material as it takes. When I get in there, if I find out that I have to replace all the plywood sheathing, I'm going to charge you for that. Everything I do that your roof needs, I'm going to itemize it and give you a bill. I said, well, okay. Then another contractor came in and said, yeah, I'll do your roof for $7,000. I said, but aren't you going to climb up there and see if it's spongy and whether you have to take the shingles off? He says, nope, I'm giving you a flat rate. If I'm right on what I think I see, I might make a little money. If I'm wrong, I'm going to lose money, but I'll do it for a flat rate. More and more of our work is not going to be time and materials anymore. We know that well in home care because that's the way Medicare pays us. But the rest of healthcare still has a long way to go before everybody's being paid on the, I think I can do that for $7,000. And we're at risk if, in fact, it goes significantly over that. And then lastly, healthcare, our patients. Our patients are getting a lot smarter. The web is opening their eyes, and there's this talk of an explosion of misinformation. Because thus far the web hasn't found a way to really credential the websites. So you may be visiting patient homes and they say, oh, but this is what we're going to do for my diabetes. And you look at it, it involves all sorts of alternative and complementary therapies that may in fact support what you're doing in more traditional allopathic treatments for diabetes. But it may also complicate and contradict much of what you're doing as well. But what I'm finding with Vermonters is it's not so much they're getting smarter about clinical parts of healthcare. I bet you could go among yourselves or walk up and down Main Street here and say, where's the cheapest place now to get your prescriptions filled? And everybody will know where to go and where to stay away from because people are becoming much more aware of healthcare costs than they ever have before. So there are questions for us about healthcare reform. What is it going to mean for our patients? What is it going to mean for our employees? What is it going to call? What kind of talent do we need on our boards as these change occurs? Are we going to be more freestanding or less freestanding? Will our agencies have to give up a little bit of autonomy in order to gain a little security? How are those relationships going to work? Janet is going to have hair that is as white as the snow, I would say within 36 months, because stuff is happening out there. At least she'll have hair. Before the Obama administration, I had hair like this. Where's somebody here? I had hair just like this, only much longer. I didn't have this shiny thing on my head. Times are changing. So we talk about leadership, and leadership is often thought of as, well, that's the board's job. It's your job. You're the leader. Janet's the leader. No. We can't get through what we're going through on that new twisty road unless all of us share in the leadership. We all need to share the leadership. We all need to be thinking about what can we do to help this agency through turbulent times. What is it going to take to really optimize, if you will? Let's move ahead to, thank you. Again, how much do we have to change in order to survive? It's a fundamental question. Remember, if we never changed, we'd still be living in caves and places like that. So we know how to change, we just haven't done it. So let's look to the future. A basic premise is if we don't touch the future, it's not going to be as good as it would be if we do touch it. We touch the future through good strategic planning. We touch the future by staying very close to the realities of the day-to-day work that our staff are engaged in. We touch the future by listening to what our community is telling us. We touch the future by being very informed about what's happening in healthcare. We use that information to bend the future to our advantage by intervening early. Janet was a very effective speaker at the Vermont Hospital Association last week, engaged, present, part of the action, not sitting back. It's as if we were to say, if change is inevitable, should we lead it or just sit back and wait and see what it is? Most healthcare leaders in Vermont are saying, if change is inevitable, it's better to lead than to be changed. Better to lead change than to be changed. And we use this simple little diagram to describe it. It's the little steps like going upstairs, and it talks about change is coming. Oh, no, it's not. It's denial. Change is coming. Well, I'm going to fight it. Opposition. Change is coming, and I can't do a thing about it. Resignation. Change is coming, and maybe it's time for me to get curious. Learn about it. Become articulate. Read. Speak. Listen. Change is coming. Maybe it's time for to work with the board and leadership to reposition this agency so it's in a better position for the future. Change is coming. Maybe we need to fundamentally adapt different aspects of our agency in order to reach the top of the stairs and actually capitalize and make the change work for us. Every agency is climbing those stairs. Every provider is climbing those stairs. So what does it mean for your agency? Well, I think, and you know, the temptation is to come here and say how everything's really good for home care. I really believe home health and hospice right now, in terms of healthcare reform, are in the sweet spot. Just the jargon that you hear, continuum of care providers, that's what you are. Post-acute care, that's what we do. Complex care management, you're among the best in the state in doing so. Community-based long-term care, we've been state leaders in that for years. The right care at the right place, that's fundamental to what we do. Handovers rather than hand-offs. We're very good at that because of the close relationship we have in particular with our hospitals, fostering a positive patient experience and patient engagement. End-of-life care, bending the cost curve. We know how to do this. Lots of other providers are trying to get in on our game. You're in the sweet spot. So what are the bottom lines? We've been changing, skip a slide. The important reformers, and I'm one of them, have been too doctor and hospital centric. We're kind of going, or it's like the V8 thing. Should have called a nurse. Should have called the VNA. Should have called hospice. Because the stuff that we're being called on to do, reducing admissions and ED use, better documentation for quality measurements, closing the gaps in clinical protocols, finding the so-called ought-to-be patients in our community, patients who are actively engaged, but we need to see them because otherwise they're going to be train wrecks. Nursing has a major role to play in solving the primary care shortage. My head hurts from doing that. And hospice, I believe, needs to be positioned for rediscovery because hospice is now everybody's been talking about. So, bottom line for you, we've been changing throughout our careers. We understand much of the future will be familiar, but much of it will also be fundamentally different. We know that our collective effective leadership is awake and open to change, that we need to be adept at all kinds of politics. We need to be able to question and challenge and push back against partners who are much larger than we are, have more money and more political influence, but we need to demand answers in order to work collaboratively together. We need to be intolerant of complacency within our own organization and among our peers, and be willing to engage, adapt, and capitalize on what's ahead. So, what's ahead? The future. We're navigating a new road. We're looking for answers, and if you can't see this, this is a road sign in Greek. And yes, some of the road signs that we see in the future as we're driving down trying to find answers will be in Greek. We will not take the exit that says memory lane. We will not take the exit that says carefree highway and easy street. We will make some wrong turns. We will run into some dead ends. We will run into rough roads. I'd like to know where this street sign is, but this is the map out of the. This is the way out of where we are right now. This is the way out. We have to navigate it. No, it's a little bit like a maze, like a corn maze that you drive through. This is certainly not what it's going to be. It will not be boring city, but we may, if we work hard, find the hope and the confidence that we need to get through this. So some advice for you. We can worry ourselves into paralysis and despair. We can all become worrywarts, which is what my little brother really was. He was a worrywart. Not anymore, but he started out life as a worrywart. We can start out like Christopher is. And just say, we can't deal with this, it's all too much. We can get angry and frustrated and yell at the world. Or we can call in the experts, take a deep breath. Dr. House and Nurse Ratchet. We can get organized and work through the capital P political system as well as the lowercase p. We can use that system to advance our interests and our cause. And we can think about how far we've come. This also is a picture of Jim Manahan sitting saying, where were the deer? But we can think about how far we have come. We can be engaged and optimistic, stride ahead to the next stage of our agency's evolution. Last week, Janet said, as far as she was concerned, it was all about baseball. You've probably heard this from her 1,000 times. Note that I put the Cubs between the Yankees and the Red Sox to maintain peace here. And little Franklin County home health gizmos, too. She said that it's like baseball. Our agencies are skilled teams of players. And we acknowledge that teamwork is one of the crowning attributes of home health and hospice. At the VNA in Chittenden County, I was always baffled because every team said theirs was the best. They say, everybody's got my back, and they know I've got their back. And we can do this work, whether it's a blizzard or blazing hot or floods, we can do this work. We're a team. But they're team members who know what they're doing. They know a rule book. They know each of them have plays. They know each of them have roles to play. Whether the role of the pitcher and the role of the outfielder are very different. We are a team, but we know the rules, we know the game. And we know the fans depend on us. You guys are 44 years old now. You're into treating your third generation in this community. So you can start to think now about standing on the shoulders of those who came before you. And in many respects, Janet is like the general managers of the Red Sox. And if you talk to the general manager of the Red Sox, he'll say, first and foremost, it's all about the fans, and the fans are our community. It's all about hearing them cheer. It's all about keeping the seats full in the stadium. And the only way I can do that is if I have excellent teams, excellent players who play baseball beautifully. But more importantly, she would say, I stand on the shoulders of all the managers who were responsible for this team before me. And every one of you, whether you're a therapist, a social worker, a nurse, an accountant, whatever your role is, your agency is now old enough that you're standing on other people's shoulders as well. And so right now is Janet's turn, your board's turn to step up to the plate. Tap it 3 or 4 times with the bat. Put the bat over your shoulder. Watch that pitch come and knock the leather off, and listen to the fans celebrate you and everything about you. And if you do it well, their grandkids will come watch your grandkids play. That's what it's all about. It's been a pleasure to talk to you.